Pathological myopia. History of pathological myopia. Myopia was derived from the original Greek word myopia, contracting or closing the eye. Galen was the first to use the term myopia. Antonio Scarpa, in 1801, first anatomical description of posterior staphyloma, but did not make the link to myopia. Carl Ferdinand von Arlt, in 1856, first connected staphyloma and myopic refraction. Brian J. Curtin, in 1977, classification scheme for staphyloma. Takashi Tokoro, in 1988, the definition of pathologic myopia. Definition of pathological myopia. In clinical term, refractive error must be -6 diopters or greater. According to Duke Elder, myopia with degenerative changes, especially in the posterior segment. According to Tokoro, myopia is caused by pathological axial elongation of eyeball. A more specific, a rapidly progressive error which starts in childhood at 5 to 10 years of age and results in high myopia during early adult life, which is usually associated with degenerative changes in the eye. As you can see in the picture of myopic eye, this is the normal eye at your left. Images are formed directly on the retina, creating good vision at a distance. So next, we have the myopic eye. Images are formed in front of the retina, causing blurry vision at a distance. With using correct spectacles and contact lens, full vision is possible. Very high myopic eye, images focus is too far ahead of the retina, so the vision becomes very blurred. Full correction is not possible with spectacles. Synonyms for myopia, we have the degenerative myopia, progressive myopia, malignant myopia, high degree myopia, and magna myopia. So these are the interesting facts. Lengthening of the posterior segment of the eye commences only during the period of growth, which is active growth. The eye and the brain show precocious growth at age of 4 years. The brain is 84% and the eye 78%, and the rest of the body 21%. After this, both the eye and the brain increase slowly while the body grows more rapidly. However, when axial myopia continues to progress, it is interpreted as a precocious growth which has failed to get arrested. We do not know yet what this influence is. Etiology of pathological myopia. The rapid growth of axial growth of eyeball is witnessed as the main cause for the pathological myopia, which is an equivocal and outside the normal biological variance of development. No satisfactory theory has emerged to explain this, but it is definitely linked with, first, role of heredity, second, role of general growth process. Role of heredity. It is now confirmed that genetic factors play a major role in the etiology. It is presumed that heredity-linked growth of retina is a determinant in the development of myopia. The sclera, due to its distensibility, stretches with retina, but the choroid cannot and undergoes degeneration, which in turn causes degeneration of retina. So here's the genetic factors and general growth factors. Next is more growth of retina than stretching of sclera. So when increased axial length, there will be degeneration of choroid, then degeneration of retina, degeneration of vitreous. As you can see the clinical picture, the picture shows image magnification, anisometric amblyopia subnormal visual acuity, visual field defects, impaired dark adaptation, abnormal color discrimination, suboptimal binocularity muscae, volitantes. So these are the signs. Prominent eyeballs, anterior chamber is deep, large and sluggish pupils, visual field contraction. ERG may be subnormal but due to chorioretinal atrophy. Complications. We have retinal detachment, complicated cataract, vitreous and choroidal hemorrhage strabismus, Fixus convergence, normotensive glaucoma, myopic foveoschisis, posterior staphyloma. So this is the view of the picture of the pathological myopia complication. So here is the treatment for pathological myopia. First, we have the optical treatment, surgical treatment, general measures, low vision aids, genetic counseling, prophylaxis. So, I will show to you to the next slide these different treatments of the pathological myopia. So, here's the optical treatment. This is what we call the primary eye care or primary treatment for pathological myopia, including the spectacles, contact lenses, or eyeglasses for correcting the refractive error of the patient. So the surgical treatment, we have the LASIK, refractive lens exchange, and phakic refractive lens, also called as implantable contact lens. So in LASIK, as you can see in the picture, a flap of 130 to 160 microns thickness of anterior corneal tissue is raised with microkeratome. Refractive lens exchange, so for myopia of more than 100 minus 12 diopters, so this clear crystalline lens is extracted and placed or implanted on the patient's eye, while the phakic refractive lens for myopia of more than minus 8 diopters, a special type of IOL is placed in anterior chamber or posterior chamber anterior to natural crystalline lens. So thank you for watching my video.